In keeping in line with the collaborative effort of the Government of Tanzania under Her Excellency Dr. Samia Suluhu Hassan, as well as the Ministry of Health and the President's Office, attempts have been made to improve the standards of emergency care in Tanzania. The Improving Emergency Care in Tanzania IMECT project is a collaborative public-private partnership that is funded by the Government of Poland through Polish Aid and implemented by the Polish Center of International Aid, the Aga Khan Health Service Tanzania, alongside the Government of Tanzania.
Unataka kumpa first aid mtu ambaye amepata closed fracture, sawa, sehemu yote ile. Angalia joint above, joint below, and then funga just a little bit kwenye ile joint above, just a little bit kwenye joint below.
The IMECT project in Tanzania is first and foremost about saving lives. It is not a humanitarian aid project, this is a development aid project, but it is meant to capacitate the health services of Tanzania to save lives of people affected by emergencies, by accidents, by life-threatening situations. Our expectations of Aga Khan Health Services was actually from the very beginning very high. We knew how professional they are, and they have completely lived up to those expectations.
And the idea was to transfer the experience of the Aga Khan hospital's very strong emergency services, and we got a funding of $746,000 for 2.5 years to upgrade the public sector emergency services in both Mwanza and in Dar es Salaam. Apart from that, we've been able to look at how do we ensure that we are able to get a permanent training center that could be located in Dar es Salaam for both the public and private sector, but at the same time a location that the hospital was able to provide for the construction and the equipping of the emergency center.
The United Republic of Tanzania is the world's 22nd most populated country, with the 2022 census showing a population of 62 million people, with more than 60% still living in rural areas. Medical care in Tanzania is progressing and is expanding, but there is still significant gaps made worse by the existing non-communicable diseases as well as HIV, malaria, and other infectious diseases. In keeping in line with the government's efforts and the efforts of the Ministry of Health, we tried to explore on how we can help expand emergency care across the nation.
Emergency care in Tanzania is one of the priorities of the Ministry of Health. As we understand, if we improve overall emergency care, pre-hospital and at the emergency department, we can improve the overall hospital mortality and reduce it by 40% of all the preventable deaths.
My experience in the partnership with the Aga Khan Health Services in implementing Improving Emergency Care in Tanzania projects is really interesting because all interventions were aligning to the national or Ministry of Health priorities in the area of emergency care.
In order to start this project, where the inception was done in September 2022, where we started with various components to be able to improve the overall tackling of emergencies in the country. Some of the major components of the project are, firstly, trainings. So we decided that it is important to equip the medical and healthcare workers with skills necessary to tackle any acute emergencies as they come in, be it medical emergencies, surgical emergencies, traumas, and the like.
Through this program, most of our members of our team, including the nurses and the doctors, have been trained. We have around 20 medical personnel have been trained in our facility. We have at least 20 cases every day in our facility. So the program has been of much of help in day-to-day conduction of the procedures. And the other thing, we have acquired also some equipment which are very essential for practice in the emergency department here.
Na tunakutana na kesi ambazo zinarelate na mafunzo tuliyoyasoma. Kwa tuna manage kulingana na tulivyosoma na tuliweza kuokoa wagonjwa wengi na tumeweza kuwapeleka wagonjwa wengi hospitali na wakafika salama katika mpangilio tuliowawekea.
Training Center has assisted in making sure that all the equipments and supplies are available and set up so that participants can actually go and train there quickly. Apart from that, it has assisted in training staffs that are in the hospital, especially at the emergency department, because it is a very crucial department in the hospital.
And we have several trainings that are undergoing, including American Heart Association certified courses like basic life support, advanced cardiovascular life support, as well as pediatric advanced life support. So we want to empower people to be able to manage these traumatic conditions in a prompt manner so as they're able to save lives.
These trainings, especially for the services who help road accident victims, are also very important because Tanzania is ranked as the 10th country with the highest number of road accident victims.
Over the course of 2.5 years, from the start of this project in 2022 to the completion of the first phase of this project in December 2024, we managed to create 167 instructors in all these different courses. And the instructors were given the room to teach and therefore ensure sustainability of these trainings and of these classes beyond the scope of this project as well. Up to now, in the 2.5 years of the first phase of project implementation, we have managed to train 2,336 providers and healthcare workers in all these different courses.
Hali ilivyo kwa sasa kwa upande wa magonjwa ya dharura kwa Tanzania imekuwa ni hali kubwa sana. Wagonjwa wa dharura wameongezeka sana kwa sababu kwanza uelewa umeongezeka kwa watu wa huduma. Kwa hiyo kwa ujumla magonjwa ya dharura ukilinganisha na miaka ya nyuma, uelewa umekuwa mpana sana.
Katika mradi huu wa IMECT umenisaidia sana katika kuhudumia wagonjwa katika kuokoa maisha yao.
Kwa ufupi tunaweza kusema kwamba tumeimprove kutoka sehemu ambayo ilikuwa sio nzuri na sasa hivi tuko katika hali ambayo ni nzuri. Tunaweza kuhudumia wagonjwa kwa wakati na kwa kutoa huduma ambayo iko sahihi.
Another important component of the project was to touch the community. How we thought would we be able to engage the community in participating and in being able to take care of emergencies before they even reach the hospital or the emergency department. Since we do not have a clearly defined pre-hospital system, it was very important to target the people who are normally the first people who reach the scene of an accident or the scene of a disaster.
I think the most important are the first aid trainings for the so-called first responders, which are scouts, which are firefighters, police officers, traffic police, who are usually the first ones at the scene and who can help the victims. What is important is that in Tanzania, these services, they do not have the first aid trainings in their job. They are not equipped with any first aid kits. That's why our trainings may bring, and we do hope they will bring an impact to the country.
And we managed, by the end of the first phase of the project, to train 167 first responders from different institutions in first aid. And this, of course, was accompanied with the provision of a first aid kit to all of them to be able to equip their centers better.
Kabla ya mafunzo, kuna vitu vingi nilikuwa sivifahamu. Jinsi ya kutoa huduma ya kwanza na vipi naweza nikamhudumia mtu aliyepata ajali ama mgonjwa. Sasa baada ya kupata mafunzo kutoka IMCT, nawashukuru sana kwa sababu sasa nimepata elimu katika kutoa huduma katika jamii ambayo imenizunguka na hasa katika kazi yangu.
Nilikuwa sina ujasiri wa kumkaribia mtu ambaye labda maybe amevunjika, mtu ambaye ana bleed sana, na baada ya kupata mafunzo nimekuwa jasiri.
Tunafurahi shirika limetupatia first aid zile za kuweza kuweka kwenye magari yetu, mradi emergency itapoweza kutokea tuweze kushiriki na kuweza kumwokoa kwa kuanzia.
In order to further solidify and notice how we can manage to now go to the real-time setting and make an impact in the specific departments or in the specific hospitals, we invited 3 specialists from Poland.
We're here to talk to medical staff and see what they want to learn and what are the possibilities for them, because there are some things that are made different in Poland that are made in here, so we also need to gather information. What can we do with the resources that they have?
I definitely learned a lot about management of diseases that we don't really see every day in Poland. But for my part, I try to share experience in ultrasound and taking care of patients after trauma.
So I'm part of the team from the PCPM. Basically, we are supporting and cooperating with A&E's departments here in Dar es Salaam, just for supporting doctors, nurses, exchange bilateral experience, and maybe collaborate in the future.
In the first year and a year and a half of project implementation, we decided it is very important to have a place solely dedicated to training people. And in December 2023, we officially opened up this training center, which is equipped with advanced mannequins, advanced sim rooms, as well as an arena to teach in theory and be able to learn conducively.
Kumbuka hizi ni joints, ndio eh? You need kuifanyia mazoezi sawa pale maumivu yanapopungua ili baadaye isije ukapata stiffness.
We hope to take this first phase of the project as a learning experience, and we will save the lives of all our fellow Tanzanians with any possible emergency through the implementation of quality emergency care. From the implementation of the project, starting from September 2022, up to the end of this first phase in December 2024, we have made a significant impact in the facilities we have touched and beyond those facilities as well, in making a dent on the gaps that exist with emergency care in Tanzania. We are very appreciative to the donor, the Government of Poland through Polish Aid, and of course the support from all the implementing partners, including PCPM, Aga Khan Health Service Tanzania, as well as the Government of Tanzania through the Ministry of Health and TAMISEMI. We have made significant impacts, but this is just the start. The aspiration that we have is to go beyond. We have touched Dar es Salaam and we have touched Zanzibar and Mwanza a bit, but the aspiration is to expand geographically, to be able to touch a lot of other cities through geographical expansion, through the procurement of more equipment, through training of our healthcare staff, through establishment of more training centers, maybe in the northern region as well as the southern region, and through working with different first responder as well as first aid agencies across the country, keeping in line with the efforts of the government to take emergency medicine to another level, we hope to take this first phase of the project as a learning experience and to build beyond that until one day we can proudly boast that Tanzania has a full coverage of emergency care across all facilities at district, at regional and at national level. And we will save the lives of all our fellow Tanzanians with any possible emergency through the implementation of quality emergency care.